Lobaz here. I've had a few people ask me lately, what is Shockwave? So I want to go over that a little bit and kind of introduce it to you. So a lot of times we have issues that pop up that are, like even like headaches. We deal with a lot of shoulder issues in here. We deal with a lot of hip, sciatica, knees, even plantar fasciitis. And so how do we do that? And how do we do it differently? Well, we use something called the Shockwave unit. And this is what it looks like. This is the wand. It has a sound that actually comes out of here and penetrates into your tissue. Now, a lot of times people will ask me, is it dangerous? Well, no. We want to make sure first that you're a good candidate for it. But typically it feels like gentle pulses, sometimes slightly uncomfortable in the beginning, but people usually adapt pretty quick. What does it do? Well, it helps break up tissue. And when it does that, it increases blood flow to that area, providing that tissue with oxygen and nutrients again. And it wakes up these like healthy tissue. It wakes up healthy cells that need to be woke up in that area. Sometimes they'll even say that it helps stimulate like stem cells. So you may have heard of stem cell therapy for like knee pain or shoulder pain or something like that. Well, this just kind of naturally does that. Now, the cool part is there's no downtime, there's no drugs, there's no surgery, and it helps with this stubborn pain that sometimes people have been struggling with. So, for me, I prefer non-invasive stuff if we can do that first, and then we kind of work up the ladder, right? So like, I want to do things that, are going to be the least painful and the most effective. And that's what I found with Shockwave therapy, and that's why we use it here in the office. So if that's you, you're dealing with some stuff like that, give my office a call. Let's see if we can help you. We actually do a free consult where we sit down and talk about your issue, and then we do an exam to see if it's something we feel like we can help with. And then we'll even give you the first Shockwave for free. Okay, so it's on me. We're gonna see if it helps you before we do anything any further. If that sounds like you, give us a buzz. All right, have a great day. We'll talk soon.